Dr. Kendall has modernized public health in British Columbia in a couple of really key ways. He is really focused on the health and well-being of Indigenous people, which is a very timely thing. He is focused on immunization and the role that it plays in protecting us. He's focused on harm reduction and why that's an important intervention for people who are really in severe pain and in difficult situations.
Some of the major projects that I've worked on here have been in the area of harm reduction and having a drug policy that is evidence-based. And the thing I'm probably most proudest of is having worked with a very large number of people, politicians, scientists, advocates, and injection drug users to establish Insight, the first supervised consumption site in North America.
Harm reduction is anything that keeps the public safe and keeps the individual safe. The most important benefit is that people are alive. People have housing because of Insight. People are clothed because of Insight. We would still have an HIV epidemic that would be greater than per capita New York if it was not for Perry Kendall.
The most rewarding aspect, it's a challenging question, but I think it's been working with a large number of really dedicated, really intelligent, really focused individuals in the public health arena, getting the focus on Aboriginal health and being a contributor to the creation of the First Nations Health Authority in BC. And I think working, with some success in convincing government that their role in improving health is bringing in policies and programs that will make the healthy choice the easier choice.
So Dr. Kendall was the principal author of a couple of publications that were very important to modern First Nations health. One of them was Health, Crime and Doing Time, the other Pathways to Health and Healing, where we looked at a number of health indicators that really showed us some very dramatic outcomes that really needed intervention, and we did exactly that.
It is rare in public life to see somebody who has such an important and pressure cooking kind of position to be always so even-keeled and take it in such great stride and to really bring forward, I think, important, sober comment on the health and well-being of British Columbians. It has been a complete honor to know Dr. Kendall.
I hope that when I leave, that the legacy will be that the Provincial Health Officer is seen as a reliable, truthful source of information that people can look to if they want an answer to a problem, or that the public will believe as a credible source.